Okay, we've got it. We've got it live again. We have a great patient from Ontario. We love our Canadian patients from the cold north. And you had an interesting situation. You had what we call asteroids. What were your symptoms with that?
Probably the best one way to describe it would be like looking through a screen, maybe. You know, lots, very, very fine dots.
Was that indoors, outdoors, or mostly against a clear sky? Or
I, mostly indoors, actually.
okay,
Seem to be the worst.
yeah, but your asteroid. When I initially started doing laser in the vitreous, I didn't think it worked very well with asteroids. But there are certain types of patients that have clumps of asteroids that are not. Asteroids are the definition is little stars, of course, and it looks like on the inside a bunch of little stars in the sky. Except in certain cases, it looks like the Pleiades, a star cluster, and it's dense and you can't see beyond it. So if the asteroids are diffuse and evenly spaced apart, they are what they are. If they aggregate into clumps, which they often do, these clumps can lie sometimes close to retina and actually obscure the object you look at so much.
Yeah, and that's the case with me for sure, because I used to get very large clumps, and what you've done has been really successful for me.
Yeah.
Over time, mind you, we have to treat it periodically because they do seem to clump up. But
Sometimes they do. I mean, obviously everybody's a little different. I did, 2 years ago, 4 laser sessions, was it?
Yep.
Yeah, and then you're here again in Florida this year. You had a couple aggregations or clumps, and I just did one session, which better is the enemy of good. That's an old expression we use in medicine. So what do you think of it from day one in general?
Oh, I mean, it's definitely improvement. As I explained to you earlier, is that I had a very large cloudiness that went over the vision part of the eye, and it would zip back and forth continuously. So you were able to get that and clean that up this term. So
Yeah. What I did was basically it was a very, very tight clump of little asteroids, and I dissipated that to a decent degree. And of course, you still have asteroids in there, but everything's better.
Oh yeah,
And that's the goal. It's better.
That's for sure.
And it was easy, and you're happy. And that's
Oh
what
yeah,
counts.
no, it's an easy process. That's for sure.
Maybe the guys from Canada will try this sometime.
I keep pushing you.
Okay, well, that's great of you. Thanks a lot. You're a great patient. Have a great time up north.
Okay.